Hi, I'm Dr. Vikram Velker. I'm a radiation oncologist at the London Regional Cancer Program. In the first video, we gave you a basic overview about the different types of brachytherapy, low dose rate and high dose rate brachytherapy. In this video, I'm going to give you a bit more information about low dose rate brachytherapy, also known as a permanent prostate seed implantation or just a prostate implant. To recap, this technique is used to treat patients primarily with early stage cancers, and treatment is delivered through radioactive seeds that are implanted directly into the prostate. This is typically the only form of radiation treatment required for early stage prostate cancers. Similar to when you had your prostate biopsy, you will need to do a bowel preparation before your prostate implant procedure. When the bowel is empty, we can easily see the prostate during the procedure, which allows us to get the best possible seed placement. If you're coming from out of town, you may wish to travel to London the night before, as we do require patients to be at the hospital typically around 6 a.m. the day of the procedure. We ask that you do not eat anything after midnight the night before your procedure. Clear fluids are okay up to 3 hours before your scheduled appointment. Unless advised otherwise, you can usually take your usual medications with a sip of water on the morning of the procedure. The day of the procedure, you will report to the hospital to the pre-admitting area. You will then be asked to change into a gown and an IV line will be started. A hospital staff member will then bring you to the operating room at the London Regional Cancer Program, where you will meet with the anesthesiologist. The anesthesiologist will make sure that you are feeling well and able to be put to sleep. Before the procedure begins, your radiation oncologist and brachytherapy nurse will also meet with you to answer any additional questions you may have. Once your questions have been answered, we'll move you to the operating theater and your anesthesiologist will give you the necessary drugs which will be used to put you to sleep. Before you're asleep, you'll probably notice there are a lot of people in the room. These people all have a role to play in your procedure and include your brachytherapy nurses, radiation therapists, and radiation physicists. They work together with your radiation oncologist to ensure all parts of your procedure are performed in a high quality, safe, and efficient manner. Once you are asleep, we will position your legs up in stirrups. By positioning your legs in this fashion, you're in the best position for us to view your prostate using something called an ultrasound probe. Before we insert applicators into the prostate, we do a final rinse of the rectum with water just to make sure that it is clean and empty. This allows us to get the best possible picture with the ultrasound probe during the procedure. The probe will be inserted into your rectum so we can see the location of your prostate during the entire procedure. The ultrasound probe we use to help guide the brachytherapy procedure is similar to the ultrasound probe that was used during your prostate biopsy. We use the ultrasound images as a guide to carefully place applicators into the prostate through the perineum. The perineum is the patch of skin just in front of the anus and just behind the scrotum, and is the most direct route to reach the prostate from the outside. We also place a catheter in your bladder to drain any urine during the procedure. Now, we know that prostate cancer at the microscopic level can involve all parts of the prostate gland. So we treat not just the tumor itself, but we target the whole prostate. Once our applicators are placed, we then create a customized computer plan to determine how many radioactive seeds we will need for your implant. We use each applicator to place individual radioactive seeds in the prostate using a special device that is attached to the end of the applicator. The computerized planning systems keep track of each seed as it is placed in the prostate. After the radioactive seeds have been placed, we will remove all the applicators from the prostate and remove the ultrasound probe from the rectum. As a check of quality, we also do a series of X-rays pictures of the pelvis, which will be used just to verify the number of seeds that have been implanted. After that, the procedure is officially complete, and you will be moved out of the operating area into the recovery area, where you'll typically spend some time waking up and recovering from the anesthetic.